Hey, deserving listeners, couples therapy, let's watch. My name is Dr. Kirk Honda. I'm a therapist and a professor. I want to remind everyone that since this is a psychology YouTube channel, we might get into some triggering material. I usually try to warn people about common triggers, but there are a lot of different triggering topics out there. So watch with care, talk with your therapist, check in with yourself as you're watching. Let's watch.
Mm-hmm. I do feel like he was
waiting behind the curtain.
Yeah.
For sure. Yeah.
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 And boom, she just did what I do and what a lot of therapists do, that you have that phrase, he's waiting behind the curtain. It has that power and that image, and it's his words. It's what he did. And it provokes empathy. I might cry thinking about it, but she sees him for his traumas, not as a withholder, which is the way she would normally see it, or as weak or something, or as a rejecter. But I think withholder is, the way that she would see it negatively. She sees an 8-year-old boy who's avoiding conflict, trying to please her so that she won't run. Interesting little moment. I don't know what was going on for him. I think they're both looking at each other, realizing, wow, we both now see the situation. So that was really masterfully done by Orna, and I'll commend the clients for working with her on that. And great session. Yeah. Now, this doesn't fix a situation. I say this because I worry sometimes that even for you novice therapists out there, sometimes it sounds funny when I say things, that it can feel like, okay, well, we're done, right? I had to learn the hard way that this is just the beginning. And they might need another 5 to 10 years of working on this every week to see a 75% reduction in this pattern. Knowing is half the battle, but there's another half to the battle.
Anticipating that while we're good now, it doesn't mean we're not going to have moments where we're not good. So I'm anticipating that it's going to bring back, I don't trust you, and...
It might.
Right, so I'm not interested in doing that for the next 50 years.
Okay, so this is where I don't know if Orna wants or knows to step in with this. I specialize in infidelity recovery, and this is a very common, if not universal, feeling for the cheater. So to catch you up, they came into session and said everything's been going really well, and they're reconnecting emotionally and physically, and they're going great. But they're just kind of worried that it'll get bad at some point, and they aren't looking forward to that. And so Molly is saying that she predicts in the future that something will trigger him regarding his pain, his hurt about having been cheated on recently, and he'll bring it up again, and she'll have to deal with that, or he'll get angry, or he'll withdraw or something. And he's basically saying, well, I don't have any plans on that, but, it might, who knows? And then she says, which is, I've heard this so many times, they'll say, well, I don't want to be dealing with this for the next 50 years. Or when does this end? Or when are you going to move on? Or how come you're not, I've already apologized so many times and we're good now, right? I don't understand why this would come up again. Why is it coming up again? And this is why it's important to be a little bit more directive and educational as a therapist in a situation like this, to tell the cheating partner it's universal that the cheated on partner will be triggered in all likelihood for the rest of your relationship. Now, each time we can talk about a protocol to follow, because there is a pretty easy protocol or an approach, but it's going to happen in all likelihood. And that doesn't give the cheated on partner license to just bring it up to punish you or be inconvenient or something. But when triggered, it's an opportunity for healing that, think of it as a cycle that comes around every now and then or something. And the way that it will look in the optimal form is that he will get triggered, unfortunately, and be reminded. Maybe it's you on your cell phone texting, or you run into that person, the person that you cheated with, or you come across an old picture that is from that time, or a song that reminds you, or maybe you come home late from work, or you go on a work trip for a week and there's no cheating happening, but it just provokes that anxiety. Whatever it is, when that happens, the cheated on partner is going to have a feeling that is involuntary, and it's incumbent on the cheated on partner that's having a feeling to be aware of it and to be differentiated enough to know, is this important enough to bring up? Because if it's just a small little thing, maybe it's not important enough, but it kind of depends on the couple's approach. If it's important enough, then it's incumbent on the cheated on partner to approach in a fair way. Okay, just chiming in here, the rest of this video will be for members of the YouTube channel. So if you're not a member, click the join button if you want to. Otherwise, please take care of yourself because you deserve it. You really, really do.